Thank you very much. A very warm afternoon to everybody. I'm very excited to have everyone here. Going straight into the sessions, I would like to just run us through what we are going to go through today as the program. So we will have 3 presentations from our very able presenters coming from different, municipalities and countries. And then we'll also have some presentations from some of our operators that have been supporting the private sector, that have been, promoting the container-based sanitation in the different regions. So we will be able to listen to those exciting presentations. So this webinar is about innovative alliances for advancing on-site sanitation and how water utilities can actually partner with container-based sanitation private service providers. So we have a couple of presentations, and I would like to take this opportunity to now introduce the speakers that we are going to have in our session today. We will have a presentation from Kumasi, and our presenter will be none other than Osi Bonsu. I hope I've pronounced that well. Osi is the Deputy Director of Waste Management Department in Kumasi, and Kumasi is the Metropolitan Assembly of Ghana. So Kumasi has a Master of Science in Water Supply and Environmental Sanitation, and he's got quite some experience in issues to do with sanitation. So we are going to hear what he has for us. Our next speaker is going to be from Kisumu, and we will have Jason Ochola. Jason Ochola, like my name, Chola. So Jason is an economist, and he's working with Kisumu Water and Sanitation Corporation in the western part of Kenya, and he's the head of commercial services in that entity. His interests obviously are in sanitation. I know some of you would be wondering why an economist is sitting on issues of sanitation, but he has great interest in issues of sanitation. So we are going to get a presentation from him. We will also have a presentation from Mombasa, Kenya as well. And in Mombasa, we will have the General Manager, Commercial and Business Development, Habiba Ali. She's going to be able to present to us. Habiba was awarded as one of the top 40 women in business. Can you imagine that? It makes me feel excited about that. And she's one of the active members, below 40 active members of the Water and Sanitation Association for Women in Kenya. And she's instrumental in, dealing with issues of development in water and sanitation in the Mombasa County. So that will be our next presenter. So once we've heard those cases of, sanitation with view of container-based sanitation, we will now move to, the private operators. So we have Fresh Life with us that are going to give us a presentation as well. And we have none other than the Director of New Cities of Fresh Life, Mr. Meotas Mungomi. Mr. Meotas has over 2 decades of experience in water and sanitation in Kenya in particular and beyond. And he led Fresh Life's growth and expansion into other cities, within Kenya, Nairobi, and he led and guided Fresh Life's strategy and operations into other cities. So that is Meotas. We will also have another presenter that will come in to also try and give us some perspective from the private sector. That's Abigail. Abigail is the CEO of CleanTeam Ghana Limited, a social enterprise providing dignified household toilets to low-income communities. And she has a master's in supply chain management and a Bachelor of Arts in Geography and Rural Development. Abigail has over a decade of experience in waste water management, and value chain leadership, and occupational health and safety. So she's also one of the Mandela Washington Award winners for 2021. So she will also give us a presentation on what the Clean Team Ghana is doing. So basically, those will be our presenters for this afternoon. And I can guarantee you that there will be a lot of learning, a lot of lessons that we will be able to pick from this. So at this point, I will go straight into our first presenter and just call upon him to make his first presentation. And this is Bonsu Osia from Ghana. Bonsu, please pick it up from there. Bonsu, you are muted.
Thank you very much, Chola. Thank you very much, Chola.
Go ahead, Bonsu. Go ahead.
Yes. Okay, please, the next slide then, since you've done the introduction already. Thank you. Yeah, so I'm excited this morning to be presenting to you all about our city, Kumasi. It is the largest city in Ghana, located in the middle on our map. And this is a profile of our city as Kumasi. Like you can see, the greater Kumasi has an area of 250 square kilometers with a population of 2.3 million people, generating 1,500 tons of solid waste and about 400 cubic meters every day of liquid waste. Next slide, please. Here you have the new Kumasi, where a number of the old municipalities have been carved out into their own metropolitan or municipal areas. And therefore, this is the Kumasi that the Waste Management Department has a mandate to manage its liquid waste. However, we have it in mind that whatever we do at the center of Kumasi has effect on the larger Kumasi, which I showed in the previous slide. Next slide, please. Yeah, so in the context of Ghana, this is how the situation in Kumasi compares to the whole Ghana. The land area of the new Kumasi is about 68 square kilometers, and then that of the whole Ghana is about 238,000. And then we have a higher population density because there are so many people moving to the center of the city because it's the largest, second largest city in Ghana. Next slide, please. Yes, with regards to sanitation situation, you can see from this slide, this is an extract from the recently launched UNICEF sanitation report, where you can see that a greater number of the people in our city depend on septic tanks. And over the years from 2010 to 2021, we've had an increase in the usage of biogas and biodigester toilets, which are new types of toilets that we are introducing in our city. Next slide, please. Yeah, so this is a SIP flow diagram, which was put together by WEDEC in the year 2015. Even though I believe it's outmoded, we can still draw a lot of data and inspiration from it. You can see that about 4% of our people are dependent on off-site systems and 93% dependent on on-site sanitation. The rest, or 3%, dependent on open defecation. However, at the end of the day, 55% of this shit is being treated safely. And then 45%, we have a challenge of its treatment. Some of them end up in the environment. Some of them also end up in various places that we do not want them to be there. And they are causing a lot of diseases and other things that affect the environment. Next slide, please. Yeah, here you can see the problem that our city has been over-relying on public toilets and facilities or infrastructure that's not too good for the human use. You can see that the public toilet, the first photograph, which is a pit latrine, is not too hygienic. And people depend on these public toilets, have to form queues and in the morning. And you can imagine that if you are hard-pressed to visit private and then you have to wait in the queue, it is not too ideal. And people are therefore resorting to open defecation and other forms like flying toilets, which are not too hygienic for our people and also safe for the environment. Next slide, please. Yeah, so if you look at the LI 1961 of Ghana, which establishes the Waste Management Department of the Municipal Assembly, you can see that as part of our core mandate is to make sure that toilets are being disposed of safely. So that is highlighted in red, which states that service toilets and dispose of human waste collected from private and public facilities. So this is a core mandate of us to make sure that the problem that has been highlighted in the previous slide is being dealt with. Next slide, please. Yeah, so here you can see that, as I mentioned earlier, our city had been depending too much on public toilets because of our location in the middle of the country where you have a higher transient population, and therefore people were building public toilets as commercial toilets. And at the point it became viable and private sector got involved because of how lucrative it was. And therefore we ended up depending on these toilets as communal toilets, where people who even previously owned toilets in their homes resorted to these public or communal toilets, and therefore collapsed the spaces in their houses and used them as other facilities like bedrooms and kitchen and what have you. But then from 2010 to date, some of the interventions that we are putting in place, the first thing that we have done is that to make sure that we strengthen our institutional arrangements. And therefore the bylaw of our assembly didn't support the prosecution of people owning houses without toilets. And we have revised the bylaw and gazetted it. Apart from the bylaw, there are 3 projects that we are running concurrently. The first one is the Greater Kumasi Metropolitan Area Project, which is a project that provides subsidy for the construction of household toilets in homes. And the second one is the prize money that KMA won as a prize winner for 2021 Global Mayor's Challenge is being channeled as a source of loan at very low interest rates. So we have established a revolving fund, and people are able to access that for the construction of their toilets, and they pay back on a very low interest rate loans. And then also through that project, we are training youth within certain communities to make sure that we are providing jobs for them. The last but not the least is the CleanTeam toilets, for which we are here today to talk about. Next slide, please. Yeah, so KMA's partnership with CleanTeam started actually in 2010. By that time, CleanTeam was not in existence, but Water and Sanitation for Urban Poor, WhatsApp, together with Unilever and IDEO, came together with KMA to design this CleanTeam toilet. Fortunately, I was part of that team that designed the toilet in UK in the year 2010. And then CleanTeam was born out of this establishment in the year 2011. And then we piloted this CleanTeam toilets in an indigenous community in Kumasi, which we call the Ashanti New Town, which has a very high dependency on bucket latrines at that time. And CleanTeam registered as a business in 2012, and they have been operating in Kumasi to date. Next slide, please. Yeah, so this is a user case that is very interesting, that a woman who is now dependent on CleanTeam toilets after so many years of dependency on the public toilet had narrated that at the end of every month, they are paying 68 Ghana cedis for CleanTeam toilet, which is very low if you compare to how much she and a family of 5 were spending to visit the public toilet and paying 150 Ghana cedis at the end of every month. And therefore, economically, we see that CleanTeam is being a way that the municipality or the assembly is using to make sure that we are reaching out to people so that they have toilets in their home, which will improve their dignity and also be a way of providing public safety, because people do not have to walk from their homes to visit the public toilets, even at night when the nature calls. Next slide, please. Yeah, so this is an extract from the agreement that KMA or the assembly has with CleanTeam Ghana, which stipulates the mandate of each entity, where we are supposed to provide a site, which we are providing a processing site for all the waste to be deposited there. And even now we are transforming it together with organic waste into compost, which the KMA is able to make sure that the site is available for that purpose. And then we also have a transfer station that we've set up, that the feces will be transported through these places in carts every day. And then KMA has given permission for CleanTeam to operate within the jurisdiction of our municipality. These are also some of the engagement that CleanTeam are supposed to be doing. They are doing continuous research to make sure that we improve on the service that we are providing for our people. And also they are to ensure safe handling of the waste that they are collecting, and also to ensure that they are recovering first the cost that they are incurring to ensure sustainability of this practice. Next slide, please. Next slide, please. Yes, so I believe this will be the end of the presentation, and I'll hand over to the next presenter to continue. Thank you very much.
Thank you very much. Thank you very much, Bonsu. That was an exciting presentation. And I'm happy that you really kept to the time. So our next presenter is going to be Abigail. Abigail, as I introduced her, she's also going to elaborate a bit more about this clean life. So Abigail, please, the floor is yours.
Thank you, Chola. Hi, everyone. Thank you for the opportunity to present what we do in CleanTeam. You've already introduced, so there will be no need to introduce myself. Next slide, please. So like Osei said, CleanTeam Ghana is a pioneer in the emerging container-based sanitation, which is an alternative to asset-focused sanitations like pit latrines, sewers, and other forms of toilets. And like he said, the concept was developed in Kumasi in 2010, in 2011, and it's a subscription-based model where our customers pay a monthly fee to use our service. And Kumasi was selected because Kumasi has a viable economy where a lot of people are already used to paying to use toilets because they have previously been using public toilets and pay as they use. And a lot of these households did not have toilets at home because most of them were using public toilets, and like Jose alluded, public toilets and bucket latrines. So far, we have reached 3,200 customers with our toilets, and we are still growing. Next slide, please. So the problem being addressed, Jose has highlighted on this a bit, but I just wanted to put some more context to it. We have over 260,000 households that do not have household toilets. Over 40% of these depend on public toilets, and they are paying about 1 cedi per use. And so for a family of 5, they are spending 5 cedis a day and about 150 cedis a month. That is equivalent to about $15. But CleanTeam is providing them an option for 68 cedis, which is about $5 a month. Next slide. So this is the CleanTeam value chain. The picture you see is a picture of the CleanTeam toilet. This is installed for customers for free, and all they require is just a square meter of space. They don't have to dig or plumb. I like to call our toilet a sustainable toilet because you don't need water or electricity to use it. Upon installation, there is a 20-liter cartridge, a plastic container. We call it a cartridge that has a screw top lid inside the toilet. The toilet is urine diverted, so the urine doesn't mix with the waste. We have trained waste collectors that will visit customers' homes and take the waste, seal it, and visit customers twice or once a week. We pick the waste, transport it to our waste treatment facility where we clean the cartridges, and the waste is handed over to another company, Safisana, who turn it into a compost using the co-composting method. They collect market waste from markets in Kumasi, mix it with our waste, and produce a compost from it. Next slide. So this is our value chain in pictures. You see the toilet, the tricycles we use to do the waste collection, our transfer site where the waste are moved from the tricycle into a bigger truck that transports it to our waste treatment facility, and where the cartridges are cleaned and the waste is turned into a compost. Next slide. Our achievements so far, like I mentioned earlier, we have reached over 3,200 households with our toilets and impacting the lives of over 16,000 people in Kumasi. We are achieving a positive gross margin. Our customers pay via mobile money. We are reducing open defecation and removing over 100 tons of waste from communities monthly. This would have ended up in open drains and caused sanitation-related diseases. We are saving our customers money and giving our users dignity and convenience. We are also saving water, about 10,000 liters of water monthly. This water would otherwise have been used to flush toilets. And we are also using deploying a mobile technology system that we use to manage our customer data. Next slide. Our success factors, I would say, have mostly been because we focus on innovations in finding local solutions. So for example, we're producing our toilets in China. Now we've moved production to Ghana, and that has reduced our costs. We also produce some of our toilets using fiberglass, and the production is done locally. We focus on finding cost-effective solutions. For example, we're using an additive that was imported, a liquid additive, for our toilets. But through research, we found that we could use sawdust, and that would reduce smell and keep the toilets dry. And that has further reduced our cost of operations. Partnership with other private organizations like Safisana to compost our waste instead of doing it ourselves have also been very key in our success, because treating waste in itself is a whole process on its own and comes with its own challenges and expenses. But having someone treat our waste while we focus on just getting the waste out of the city makes it easier for us. And support from the local assemblies is also very important. Like Jose mentioned, their support in kind by providing us a place to do our waste processing has made it easy for us to keep running our operations, because getting a private land to do waste processing would be challenging because no one wants waste in their backyard. Next slide. Our challenges, these successes have not been without challenges. We all know about COVID and how it's impacted businesses and sanitation businesses especially. And in Ghana, for the past 2 years, inflation has been crazy. And other businesses have the luxury to increase their prices, but not toilet businesses, because toilets are last on people's budgets. And so it has increased our cost of service because the price of everything has gone up, but we can't increase our prices. Fundraising to take us to break even is equally challenging. Even though we've been able to raise some amount of funds, we still have to fundraise to be able to subsidize our service, because we can't charge the low income and the vulnerable the actual amount we are spending to service them, because that will make our product too expensive and they can't pay for it. There's also competition in the market. The market in Kumasi has changed. Jose has mentioned a number of projects that are going on in Kumasi, including the World Bank project that is building over 30,000 biodigester toilets. And we are losing customers to this project. And so we have had to change our business model in a way, and I'll talk about that in the next slide. And yes, so this competition has actually forced us, next slide please, to review our product mix, just so we stay relevant in the sanitation industry, and also continue to provide value-added services to people. And so we, quite apart from the container base, which is the core of our business, we have also joined the World Bank project as an SPI to build biodigesters. At least with that one, we can make some positive margins to subsidize our CBS operations, and that serves as another stream of income. We are looking to go into septic and pit emptying. We are looking to do credit financing for some of our customers, or even people out there that can't afford to pay for the cost of a biodigester right away. And with all the experience we've amassed over the past decade, we are also looking to go into consultancy to support other people, organizations in sanitation. So all these we are looking at as other streams of income that will come in to supplement our revenues in container base and get us to sustainability and break even. Next slide. The lessons learned. One organization cannot solve all sanitation problems, and so collaborations are very important. And being open and flexible to changing and transforming an organization to reflect current conditions is also really very important. If we hadn't changed our system or changed to get other revenue streams, I believe we would become an obsolete organization in a few years' time. Government and local assembly support to create an enabling environment, especially for sanitation businesses to thrive, is essential. I don't see how CleanTeam would have gotten to where we are without the support of KME right from the beginning and even now, and the authorization they've given for our services to continue. If we didn't have that, we wouldn't have had a successful organization by now. So that is really crucial. Next slide, please. Yeah, so in conclusion, I would say, and everyone on this call knows, that sanitation is an essential basic human right, and everyone deserves a decent toilet and a place to respond to nature's call. Hence, the need to leave no one behind and the quest to make decent sanitation options affordable. But it's also time we accept that sanitation solutions are not a one-size-fits-all. Not everyone can have the ideal flush toilet, and not every community can be sewered. Hence, there is a need for tailor-made local solutions to our sanitation problems. And these should be innovative. This should be driven by innovations, and the right environment to help sanitation businesses thrive is also very important to help bring sanitation solutions to everyone within the sanitation ladder. Next slide. Yeah, that is all. Thank you for listening and for your audience.
Thank you very much, Abigail. That was a very good presentation. And I think you highlighted a number of issues that later on, as we get into the conversations, we will be able to digest and see how those things can actually be adopted and perhaps also replicated. Now, we move on to the next presentation. This is Kisumu Water and Sanitation Company in Kenya, and Jason Ochola will be able to take us through this. So Jason, please go ahead and make your presentation.
Thanks a lot, Chola. I think you've done an elaborate introduction about me. So we can move on to the next slide, which talks about the background of Kisumu and KIWASCO. Kisumu basically is a city in the lakeside town of western part of Kenya, with a population of around 600,000. Our annual population growth is around 2.8%, and in terms of level of earning, 60% of people live within the low income areas. In terms of sewerage coverage, we only do have 18% sewer coverage, which means 82% of the people are unsewered. What happens with the 82% is that only 33% have got their waste being safely managed, while 67%, hoping 67% have got their waste being not properly managed. In terms of operations of Kisumu Water, we started our operations in the year 2001. That is when it was registered. Then by July 2003, we officially began operations. Then come the year 2019, we did expand our area of work to also involve unsewered sanitation. When it comes to treatment of both water and sewer, we have two wastewater treatment plants with a capacity of 18,000 cubic meters, and that of water is around 80,000 cubic meters. The funny thing is that of the 18,000 cubic meters wastewater treatment plant, only 60% is utilized, which means a very big percentage of people still use non-sewered element. Next slide. Next slide, please, Chola. If you look at that is on the sheet flow diagram. If you look at the sheet flow diagram, on-site sanitation, this is a sheet flow diagram that was done in the year 2015. 75% still use on-site sewer, on-site sanitation. Then off-site sanitation is a meager 20%. Then we still have 5% people doing open defecation. In terms of handling through the sanitation value chain, only 67% is safely, only 33% is safely managed. Hoping 67% still stay within the environment and is unsafely managed. Move on to the next slide, please. When it comes to our operations in terms of both non-sewered and sewered, 55% of people within Kisumu access improved sanitation, which includes both off and on-site within the entire county. Then with the high population that continues to grow at 2.8%, only within CBD, we have the sewer coverage. 90% of industrial waste, however, is conveyed through our sewer system into the waste water treatment plants, while 10% are conveyed through the exhauster services. In terms of tariff and tariff on non-sewered, the tariff that is set to us by WASREB, the regulator, is still very, very silent on how we bill and collect revenues related to non-sewered sanitation. Please move to the next slide. Well, in terms of how we are handling non-sewered sanitation, we have a partnership with Fresh Life, which has been in place since 2019. We started this through piloting, through doing a business case that got the buy-in of most of the stakeholders. Then we did a pilot around 2019. And during this period, we managed to bring in a few numbers. Then the last stage now is where, that is the phase 3, is where we are now doing the saturation. So in the first phase, we only did a memorandum of a few years, but now we've again renewed our MOU, which is now running for 5 years from 2022 to 2027. In terms of what advised our engagement with Fresh Life, there was too much of contamination of our water bodies, most of the lake which we rely on for our potable water. Then most of the pits were collapsing because of the nature of soil within Kisumu. And we are also having a lot of cost element to the low-income people when exhausters were taking their waste. Then the transportation element within the low-income area is also very rigid. So we had to think beyond our nose to see how best we can manage fecal matter. So our engagement with Fresh Life is a triple P model that involves bringing them in to give us a solution, which is of high quality and also of low cost, so that the people in the low income areas, settlements within the town, are able to access sanitation component. Please move over to the next slide. Then within this period, we've managed to get a good number of achievements. We've managed to connect 1,300 people with the toilet within one estate. That is around 20,000 people. We've again managed to renew the MOU for the next 5 years, running from last year to 2027. And again, we've managed to safely manage 2,000 metric tons of fecal matter, which is a very, very big milestone that would have otherwise gotten into our lakes, which we rely on for water. Again, we've managed to contain waterborne diseases that were initially very, very common within Kisumu town. This partnership has, however, not gone without much challenges. We've had the social cultural beliefs where people don't believe in the aspects of sharing toilets in large numbers. We've also had cases where people fail to pay. This technology is meant for the low income areas, and at times they're not able to make the month-on-month bills that is given to them. We also have had collaboration issues and coordination with the county-related organs that are responsible for implementation of sanitation components. And again, there's a problem of data. We are not able to clearly get to know which other areas that have got urgent need for this technology. The waste to value component has also been a problem where we need to recycle and bring back this waste fecal matter back to use. What are the lessons that we've actually learned? Involvement of the community is very, very key. when we are doing and trying technologies that are to be rolled finally to them. Then again, we must also engage the public health department for purposes of sensitization and also reaching out to our people. Then again, getting technology the right time, the right time at the right moment, so that it is acceptable within that prescribed area that we intend to roll it out. Next, please. Then what is the future of this technology and our engagement? We have just rolled out another phase of implementation through the signing of the MOU for the next 5 years. And this one will involve moving into other areas, and we've moved on to other low-income areas within the town. The other thing is that we've actually, we are now training other water companies, courtesy of GWOPA. We are managing to train, we've managed to bring on board some other 5 WSTs within Kenya. The importance of container-based sanitation solutions have been very, very many. Since we introduced Fresh Life toilets, we've managed to contain too much of waterborne diseases, and also we've actually managed to reach out to a very, very bigger proportion of people who otherwise were not having toilets. Again, noting the nature of the soil structure of Kisumu, we've actually managed to get a solution to others. The barriers, basically, funding is a key challenge, data within Kisumu, enforcement, public perception, and also willingness to pay. Then lastly, the enablers, we are trying to work with the public health department to ensure collaboration and also sensitization. We've also involved other people to ensure that innovation is brought to on fore, and also bring in the aspect of governance. We've also trying to do surveys to ensure that we have data, and lastly, we are pitching for funds to get a fecal sludge treatment plant. I think that is the final slide. Thank you for giving me your ears. Back to you, Chola.
Thank you very much, Jason, for your presentation. I think that we'll come back to you on a few issues that probably you may need to just elaborate a little bit more. And I also thank you for really sticking to time. So for our participants out there, please, you feel free to type in your questions in the chat box. We should have time before the end of this webinar to actually address your questions. So as the presentations are being made, if you have questions, please feel free to type them in the chat box. We move on now to the next presentation, which is from Water Utility Engagement in Urban Sanitation. And this one is from Mombasa Water Supply and Sanitation Company. And this one will be made by Habiba. Habiba, please go ahead and make your presentation.
Okay. Thank you, Chola, for the great introductions, and greetings everyone once again. Next slide, please. So Mombasa's case is a unique one, as it's surrounded by water, as you can see through the pictorials. Yet we're also considered as a water-scarce city with low sanitation coverage, hence the introduction of innovative ways of advancing on-site sanitation, like the use of container-based sanitation. Mombasa has a growing population of 1.2 million people and is predominantly an urban city. Next, please. Our mandate is to provide cost-effective and affordable quality water and sanitation services to the residents. Mombasa Water is responsible for both the seaward and non-seaward sanitation in the country, with a total sanitation coverage of around 20%, which is considered very low. And that means 80% of Mombasa's existing major urban water and sanitation services deficits, which in return points towards a potentially overwhelming burden to contain the solid waste within the county. Mombasa faces, next please. Mombasa faces low access to reliability and quality of water, as we are reliant on other counties for distribution of the commodity to our residents, which also poses a sanitation and hygiene risk in our city, stemming from the population density and the large informal settlements. Our service area for Mombasa County with reticulated systems are just West Mainland and Mombasa Island. At present, a small fraction of West Mainland has a reticulated sewage system, though it's malfunctional, but in the midst of rehabilitation. The existing sewer is treated in Kipevu wastewater treatment plant and is disposed of to the ocean. Kipevu has a capacity of 17,000 cubic a day. As you can see through the images there, it compromises of an inlet works, oxidization ditches, settling tanks, sludge drying beds, and an outfall sewer. The majority of our non-sewered areas currently use on-plot or on-site sanitation, which is a mean of septic tanks and sock pits. They lack proper sludge management and disposal facilities, which we consider a health hazard to the residents and an environmental risk. Hence, the utility offers exhauster services to the residents as an alternative. Next, please. Our work with Fresh Life focuses on the on-site container-based sanitation. We've only just begun, as we've just launched the partnership by signing off the MOU. So as I said earlier, our case is very different. Majority of the presenters here have already begun the program of on-site sanitation. And as our partners in Kenya have already started a partnership with Fresh Life. So our partnership will allow us for safe disposal of waste, as most households practice inappropriate methods of waste disposal, with a number not wearing the right protective gears while handling waste at home. Next, please. So our expectations with Fresh Life's partnership will be to be able to allow us to mitigate the unsanitary methods of handling waste in informal settlements, and in addition to improving coverage in our non-sewered areas across the utilities, as well as address and prevent the discharge of waste into the environment and the water bodies. My presentation is very short, so thank you so much.
Thank you so much. Thank you so much, Habiba. That was a very short but straight to the point presentation. Again, we will come back and just maybe try to delve into some of the aspects that you have raised in your presentation. So now we quickly move to our last presentation. And this one is a presentation from Fresh Life. Meotas Mungomi is going to give us this presentation. Meotas, please go ahead and make your presentation.
Thank you, Chola. Hi, everyone. Next slide, please. Yeah, so Fresh Life has been providing affordable and reliable container-based sanitation for over 11 years. Our main goal is to build healthy and prosperous communities and cities. Next slide. So how do we do this? We do this by building environmental resilience and promoting public health and individual dignity. So those are the impact numbers so far. We are doing 3 meter fresh, where we interact with the pit emptiers and ensure that waste that they collect is disposed of in the environment in the correct way, and we even work with them to build their capacity in terms of the best practices. We are environmentally, we actually are removing about 24,000 tons of CO2 each year. We are saving about 1 billion liters of water because our toilets are dry toilets. And we built one of the biggest container-based sanitation with active toilets. That's about over 7,600 across 3 cities that we are working in. And we're glad now we are going to start in Mombasa. So Nairobi, Kisumu, and Eldoret. serving about more than 290,000 people each day. Next slide, please. So we, Fresh Life, we actually implement the full value chain and, what we call a circular business model. So we build the toilets, we deploy these toilets to the informal settlements, and we collect the waste. We safely manage collecting of the waste, and then we transport this to our partner region that does the treatment for reuse. So, the value added to end products like insect-based protein, briquettes, and organic fertilizers. Next slide. So that is this is how our what we call an FLT Fresh Life toilets looks like. It's a private shared toilet operated by local residents. We also have one we call Fresh Fits that are usually deployed to areas where we have the elderly who are not able to walk to these toilets and the disabled. Next slide. Yeah, so that is one of the pit emptiers that we work with. And the picture below there is our collection center that we collect that waste. We charge the pit emptiers a small fee to dispose, to bring the waste to our collection center, and we ensure that is disposed into the sewer system that is connected to those collection centers. Next slide. So some of the things that we are trying to address while working with the utilities and even the national government is lack of, because the sewer system, playing the sewer system is a very capital intensive endeavor. So we come in and complement the work of the utilities and ensure that the areas that they do not have, even as they plan to, do this capital intensive endeavor, we still ensure the residents living in those areas still enjoy, still have access to sanitation services. Also, with our innovation like the FLT, we are able to bring in this very needed innovation to these utilities. And also we provide data. We work to do surveys together with the government so that we are able to understand the sanitation of that specific area, so that we are able to go and innovate specific solutions that go to address the specific issues that we find within the areas that we operate in. Next slide. Yeah, so far we are working in 3 cities in Kenya. I think we should have shaded Mombasa now that we've signed in Mombasa just the other day. And also in Lusaka, we've started a pilot. Of course, the plan is to grow beyond the cities that we're operating in. Next slide, please. Yeah, so beyond that, we have, so far we have created a network of about more than 6,200 what we call FLOs, the Fresh Life operators. These are usually landlords that we engage and deploy toilets in the plots that they have their houses. We have about 413 Fresh Life employees. And right now we have 52 manual pit emptiers that are formalized. We went to this, when we go to an area and we are working with these pit emptiers, one of the key things we do is we put some order. So we put them in CBOs, so to ensure there is order and there's some regulations that is governing their work. Next slide. Yeah, so far, the solution we're providing, Fresh Life is providing, is half the cost of what the utility, the alternative, the utility, that is the connection to the sewer. We are doing about $21. That is half of the average $56 per person that is connected to the sewer. And the plan is actually to go and ensure that the $21 cost per person per year goes down by 2026 to about $12. So we're working with the utilities. We're working to find, our innovation team is trying to work to look how we can remodel things like the FLTs to ensure that it's low cost in terms of fabricating, so that we can bring down the cost and ensure that we are able to bring the cost per person per year for the Fresh Life solution. Next slide. Yes, thank you. I think mine was just to complement what Kisumu and Mombasa had presented. Thank you very much, Jola. Back to you.
Thank you so much. Now I think we straight away want to engage into some conversations with our participants. But I had a few issues actually before we engage with the participants. I just want to hear from Abigail. I think Abigail, hearing from what the Fresh Life has talked about, I heard them mentioning issues to do with inclusion, where the disabled and so on are able to access the facility. How is that working with the CleanTeam? Your toilets, how accessible are they to those people that may not be, as abled as others? Just in a minute, you could try to speak to that. Abigail?
Sorry, please,
Okay.
can you take the question again? I didn't hear you.
So I want you to speak to issues of inclusion. How are your facilities able to include everybody? Issues of disability.
Yes, so I would say our facilities are very inclusive. We have, it's disability friendly. For example, we have a customer that is not able to walk, but he has this, so it means he can't walk or crawl all the way to the public facility, and he will get messy if he tries using public facilities. But with our toilet, he can actually have it by his bedside and use it conveniently, and even for the sick and the elderly. So I'll say our toilet is really very convenient for people that are disabled, for the sick, for the elderly. We have a number of blind people that are using our toilets, and when I visited them, it was so telling. From one of the couple, they mentioned that because they couldn't walk all the way to the public toilet, they had to do it in a chamber pot, and when they go to dispose of it, they have neighbors laughing at them or teasing them. But with the CleanTeam toilets, they don't have to go through that humiliation anymore. And so it's very suitable for disability and vulnerable people. And that is why, even though we are not able to charge prices that cover all our costs, we are still pushing to find other sources of revenue to subsidize our costs, or raise funds to subsidize our costs, because these are people that really need our service, and increasing our prices would mean that we are not making it affordable for them. But can we provide other services to cross-subsidize for these people to have toilets at their disposal? So
okay, thank you for that, Abigail. Thank you for that. For Kumasi, I think Osi, you mentioned issues to do with institutional arrangements. Can you just maybe elaborate in a few words? Who are these stakeholders that are involved in this process? So you have yourselves, who else is involved in this process?
All right, thank you very much for the question. So in Ghana, we have, first of all, at the central government level, we have the Ministry of Sanitation and Water Resources, which oversees whatever in terms of sanitation that the municipalities do. And then when you come to the municipal level, here we have the Waste Management Department, which formulates policies and also implement them. And then we have the assembly level, who are the lawmakers at the assembly. So representatives of each community come together to form a Senate kind of arrangement, like assembly membership. And then it's headed by the municipal chief executive. So when we are coming up with these laws and enforcement and these issues, we have the beneficiaries. So the people that are benefiting from the facilities that we are providing. So that is a starting point. Before we enact any law or bylaw, we go through the problems that they have. The civil society, we have NGOs, we have businesses like CleanTeam and other people that are consulted. And then also we have the Environmental Protection Agency, independent agency that audits whatever services that the department or the assembly, for that matter, provides for the people of Kumasi.
Okay, thank you very much for that. Fresh Life, we have a question on the chat that is talking to issues of beliefs and traditions, religions, beliefs and traditions. So I want you to just maybe try to explain a bit about how your toilets are able to take care of some of the common beliefs and traditions that people would have around fecal sludge management?
I think Jason, because you have, maybe Jason, you can take that.
Jason, please go ahead.
Thanks a lot, Chola. One of the things that we managed to do to take care of the beliefs and stigmatization, we had to do sensitization and proper training so that people could accept that toilets is something that can be shared within the family and even beyond. So it only took us the component of sensitization, proper training to get that paradigm shift in terms of belief and all that. The only challenge that we are currently that we also have in terms of that is the wash community, the people who use water to clean up after the long call, because this is a dry toilet which separates the stool from the urine. They do not still have a proper way of managing it. But then we are trying to sensitize them that even using toilet paper is adequate enough for purposes of cleaning yourself after the long call. So it's purely training and sensitization to attain that paradigm shift in belief.
Okay, that's well understood. But before you go, Jason, you mentioned in your presentation issues of data, which I think are very important. You know, when you need to tackle this issue of sanitation, data is one of the key issues. So you say that that is one of the challenges that you are facing. So can you just explain to us how you are trying to resolve that challenge?
Through the help of Fresh Life, we've managed to do what we call tagging of plots, where we are able to establish the number of plots within that specific area. Then from there, we are able to know how many people live within those premises within the low-income areas. From there, we are able to divide equally or appropriately the number of toilets that are required with these people. The other side of the town is we are still working on concept papers and proposals so that we can have maybe some financial support to help us get accurate data on sanitation facilities that are there within Kisumu. So we believe if that comes through, then we should be able to come through with the issue of the data.
Okay, that's interesting. So the private operators are helping us to get the data. Is that what you're saying?
Yes, yes.
Okay. We now are able to get a few questions, audio questions from our participants. So please, if you have a question that you want to ask to any of the presenters, do feel free to raise your hand and then we'll pick you and you should be able to ask your questions. So participants, please, if you have any questions that you want to ask, you can feel free to raise your hand. Now, while we are waiting for that, there's a question on the chat. Somebody is trying to ask how much coverage you are able to achieve with the container-based sanitation services. And this one, I think, is directed to Kisumu and Kumasi. So they're saying how much coverage in percentage form are you able to reach with your solution of CBS? So any of you can go first.
Yeah, for Kumasi, we are reaching about 4% of the total population.
Yeah, for
Kisumu,
Kisumu, from the data that was shared by the regulator, we managed to attain some good percentage growth in terms of fecal sludge containment from 18% to 23%. So we believe this was as a result of embracing on-site sanitation.
Talking of regulators, Jason, and also Abigail, I think, how involved are these regulators in this whole process? You know, because traditionally regulators have been used to regulating, you know, the service provider, the utilities themselves. So now that you are, you know, partnering with the private, how involved are the regulators in this process to ensuring that, you know, there is an enabling environment for such partnerships? Jason?
Yes, for us on offsite sanitation, we normally share an hourly data with the regulator. That is on test results that we take from our treatment plants. That is a mandatory requirement that we have to share the data on the COD and BOD components of our wastewater. And because we have this fecal matter being handled for now by our treatment plants, it's the outcome of these results are also being shared out to the regulator. But in terms of how we want to manage it, the regulator is in the process of reviewing the laws such that we also have the sanitation offsite and on-site sanitation fees that will also enable us invest much more. That is maybe on fecal sludge treatment plant, and also put in regulatory devices to enable us to enable them monitor and oversee implementation of these governance issues. Other than that, in terms of pit latrines, this is purely being done by the public health service officers of the county, being closely monitored by the National Environment Management Authority that looks into how best these things are adhering to the laws of Kenya.
Okay, that's clear enough. But maybe let's also hear from Maltas, from Fresh Life. I just want to know, because I know that you are working in Kenya where there's a regulator, and I know that you are in the process of coming, you know, to Zambia. You've already started, you know, the engagements and so on, and you will be bringing that solution to Zambia. So now I want to find out how accommodative are, you know, the institutions that are currently governing this issue of sanitation. And I'm talking about regulators, I'm talking about government ministries, I'm talking about the different policies and regulations that are in place. How accommodative are they to the private sector to actually come and operate in this space?
Yeah, thank you very much. That's a very good question, and I think one of the key things we've been doing as Fresh Life is to work with government. First of all, like in Kenya, let me just give a context in Kenya. Initially, over the years, the focus has always been on water and sewerage. And that's why even when you had asked about the issue of data, if you asked Jason, I'm sure if you asked Jason or Habiba, if they have data on water in their areas, they'll tell you they have very good data, because the focus initially has been there. But now there's a shift because the government is realizing that they are not able to, they do not have the capacity right now on their own to actually reach out to all these residents that they have been tasked to reach out, especially on sanitation matters. And so even the current government that is there is is encouraging PPPs. So there is a framework to the different levels of government, that is the national government, county, and the county. So utilities are usually owned by the counties. So right now we have a national management sanitation policy that is still under review, waiting for to be approved. That will set up the national structure on how the private sector will handle will be working with government. However, in the meantime, what we've been trying to do is to create within that framework, create partnerships with government, like from our level to start with the utilities, signed up on MOU, look at areas of convergence, of course, bring in the county to support in terms of regulation, and so work with them towards that. So there is a lot of reception. There's an acceptance to bring in. Of course, there's so much work to be done because we still have gaps in terms of funding. We do not have a clear path on how funding can come in to private sector. Like for instance, one of the things that we are pushing is actually to a point where government can actually subcontract private sector to offer services. So like for instance, if we are working in Kisumu or Mombasa, we should get to a point where there's a framework and there's a conducive environment for us to come in and government to say, we're supposed to do this project for Siwa in the next 30 years, because these projects are usually 30 years in the making. So in the meantime, can we subcontract you and pay you to offer these services to these people so that people can still have their dignity even as they wait for the government? So there's a lot of, there's a good progress. Most like in Kenya, the association that is here is called Water. Initially, it was called Water Service Provider Association. They've just changed it to Water Service, Water and Sanitation Services Provider. So association. So it tells you most of the companies. Kisumu Water was Kisumu Water and Sewerage. Now it's Kisumu Water and Sanitation. There's that mind shift to actually now accommodate sanitation. But beyond that, what you call alternative sanitation, container-based. So there's a lot of, you could see there's a lot of uptake in that. And that is why we are able to actually now speak to other cities. Mombasa is coming on board. We are talking to other cities. There's a lot of reception, and the environment around is conducive. Of course, it is going to go, it is going to be better if we have that policy, national policy approved by government and implemented.
All right. Mautas, that is well elaborated. We have a question on the chat box, and they're saying this goes to any of the presenters. So basically what they're asking is that if these container-based solutions are such great innovations, what is stopping us from accelerating service provision towards the SDGs? So why are we not scaling up at a faster rate? And I want to combine that question with the one that has come from the issues of financials. So they're saying, Fresh Life, you seem to be providing a solution here from the point of view of financing, because you are saying that it's cheaper, like almost half the price of the sewer connection. But what is stopping you from scaling up? Is it the issue of acceptance and adaptation? So what is it? So we start with Abigail. Maybe you can just speak very quickly to that, and then Meltas, you can also maybe just give us one or two sentences to respond to that.
Thank you, Chola, for the question. So I would say affordability and acceptance is one of the key challenges. So we have a section of people that cannot afford the other services that so there are people that will use cesspit, there are people that can afford biodigesters, but there are also other people that can afford any of these options and do not have enough space to build those options. And so our option is for them. But even within that, not all of them can afford even the service we are providing. So that is one aspect of it. And the other aspect is that what we are doing is service intensive. And so we have to grow conscious of adding costs. We have to visit customers once every week to pick their waste. And so if we are not guiding our growth or growing consciously from one area to another and making sure we are densifying our customers enough, then we'll be increasing our costs of service. And so we'll not be able to cover all our costs and become sustainable or reach break even. That would mean that we would continuously have to depend on donor support to be able to operate. And so balancing between impact and cost management is very challenging. And for us, as we grow our services, we have to be conscious of how we are reducing costs, such that it is affordable for the vulnerable groups that we are providing our services to.
Okay, all right. Kumasi, you've been quiet, and there's a question here that I want you to respond to. First of all, there's an issue of how these solutions are helping in terms of managing the greenhouse gases. So just maybe try to speak to that. But also, as you speak to that, somebody here is challenging us. They are saying that sewerage connections should still be prioritized by governments. So as a service provider, just try and give your position on that issue, sewerage systems versus on-site sanitation, and also speak to how these innovations are dealing with issues of the greenhouse gas emissions. Osi?
Hello, Chola. Please, is the question meant to me?
So the question is that how are these innovations helping to deal with emissions, the
of
carbon
gases.
print? Yes, and then
Yes, so
there's a challenge. There's a challenge here on sewerage connections. So people still think that governments should prioritize sewer connections as opposed to on-site sanitation facilities, and in particular these container-based solutions. So can you speak to those issues very quickly?
thank you very much. I think I'll start with your last question. So, for instance, in Kumasi, we have about 9% of the population dependent on sewage facilities. In recent times, we've tried to expand these facilities, but it also obviously comes with its own challenges because we are not yet in a position to have mechanized systems because of the challenge that come with the operations. So, for instance, depending on the land nature, the nature of the land and topography, in certain areas, it's difficult to connect these lines. Otherwise, you would need to introduce pumping systems. And therefore, we think that on-site sanitation, especially where you have the spaces for septic tanks, is the way to go. And otherwise, like we have been discussing, with regards to container-based sanitation, which also has its own target group. In recent times, some of the challenges that we are having in terms of what is challenging CBS has been the biodigester toilets and biofuel toilets, which do not require too much space for the containment of the feces. But again, we still think that CBS still has a role to play. Okay, so with respect to the gases, like you mentioned, in Kumasi, for instance, currently we are doing co-composting, where we are combining the CleanTeam toilet with organic waste. CleanTeam has an arrangement with another entity, Safisana, and they are using this to form compost for the use of farmers. And therefore, we believe that once we are preventing people, especially from the burning of organic waste, which has been the practice, and sometimes they also bury these wastes, we thereby prevent them from excretion of methane gases, particularly. And then we will have in our landfills the excretion of mostly carbon dioxide, which is being used by plants that have been planted around the facility for photosynthesis. And therefore, we think that these facilities are helping us in that regard.
Osi, before you go, do we have data, quantifiable data on what the contribution of CBS is to greenhouse gas reduction? Can we quantify that?
I must say not from where I sit, not from here. But I know that we are fortunate to have a university in our city. And some people have been doing some work about, not particularly about CBS, but the effect of especially effective management of our landfills on the excretion of methane gases and other CFCs, but not particularly with CBS systems or these household toilets.
Okay, thank you for that. So time is not on our side, dear participants. So I would like to get us close to concluding this particular webinar. So I will ask for just one word to sum it up. One word. If you go beyond that, our presenters, I will cut you short. So I will start with Abigail. Just one word. What is your conclusion on this? What can you tell our participants?
That was on the spot. But the questions have been very insightful. That's what I would say.
Okay. Thank you very much for that. We move on to Habiba. One last word to conclude this particular session.
Mine is just to say that we need to continue looking for more innovative ways to handle the sanitation issues across our countries, and to just be grateful for everybody participating today. Thank you.
Thank you. Jason, your last word, please.
Yes, we must embrace circular economy, and the fact that we continue puncturing the aquifer for purposes of hiding our fecal matter is wrong. We must move forward and ensure that whatever we release, fecal matter, is turned and given back to the community and society as something productive in form of food or energy. Thank you.
All right. Osi, your last word very quickly.
Yes, thank you very much. So I believe that, as we have said, there's no fit-for-all solution for sanitation. And as we strive to achieve the SDG 6, we should look at various options and empower people so that they can have their dignity in having toilets in their homes. Thank you very much.
All right. And last but not the least, Meltas, your last word, please.
Yeah, so I mean, I think for me is just to create awareness and you know, of what we expected to do, because 2030 is just around the corner. So just to create awareness and have these platforms, but also go beyond having the platforms. Let's put action to whatever we speak and whatever we plan to do. Thank you.
Thank you very much, our dear presenters. I think those were very insightful presentations, and I am sure that our participants, including myself, have learned you know, one or two things from what you have shared with us. Just to sum it up from my end, I think what was coming out was that, you know, we cannot avoid issues of sustainable partnerships as we tackle this issue of sanitation service provision. We need to see how we can strategically partner with the private sector to help in terms of providing services, as we are all striving to meet the SDGs. I also got a point or two on issues of having very clear roles and responsibilities for the different actors involved. So the private sector and the public, they should have very clear roles and responsibilities on how they are going to do this. There was an issue of affordability and financing modalities which came out. You know, how, you know, there are loans that are given to households to try and acquire these toilets. So again, there the conclusion is that financing of these toilets is also a very key issue, and that should be coupled with issues of affordability. Issues of value addition, beyond just dealing with sanitation, I think we need to focus on what else can we do so that we create value for the communities in which we are working. And in there, I picked issues of job creation, you know, where we train some of our people to participate in issues of service provision. So thank you very much for being very active participants. I thank those that have typed their questions in the box. And at this point, I wish to hand over to Siemens to just give us the way forward and closing remarks for this particular webinar. Thank you very much.
Thank you, Chola, for all your rephrasings of the presentations, the excellent presentations, I would say. I'm very much honored and pleased by the presentations of Ose, Abigail, Jason, Habiba, and Meltas. I think the quality of your knowledge of urban sanitation is overwhelming. And I just want to recall that when I was working in IHE Delft, teaching sanitary engineering, wastewater treatment, urban sanitation, we all shared the one discussion that the way out for sanitation is definitely sometimes very convenient in off-site sewerage. But what you do with sewerage systems is that you dilute your waste flows to tremendous volumes, creating tremendous problems. And I think what we are seeing now in the presentations, what I have been observing, is that you do tend to do the leapfrogging. You do tend to take advantage of the lessons learned in for example, in the United States, where they dilute their human waste flows with more than 300 liters of water per day. That's a tremendous flow of wastewater that needs transportation, that needs to be treated, separated. That's hugely costly and not affordable. So I think what we see here in your presentations is that you have taken the advantage of leapfrogging to decentralized solutions, off-site and on-site sanitation systems. And although it might be that it is a kind of second-hand technology, it is the way forward because it does not mix waste flows. It does not dilute to huge volumes, but it tends to concentrate. It does reduce the transportation costs rather than creating bulky volumes of waste flows. And I think it has the biggest potential for maximizing the circular economy, as already recalled by several people. So I think we have a tremendous treasure of knowledge here at hand in our practitioners community, which we need all together to partner up and find out for the future, because that was the summary question they asked me in this webinar. What's the future? Now, I think if we take a look to 2030, one thing what needs to be done is to scale up. I saw just yesterday the master plan for Zambia urban sanitation, and the government of Zambia has endorsed a national program for 80% coverage of urban sanitation by 2030. If we would like to do that for all our cities in Africa and other countries as well, to 80% coverage by 2030, we need to join hands, public, private, water company or not water company, NGO, it doesn't matter. We all need to team up. And then we have to make sure that we set a good organizational structure, a good governance structure. We identify the financing options and the challenges. And we seek also community engagement, because we have to argue to the people that it is not just for the sake of our interest, but for the sake of public health that we do try to tackle the urban sanitation challenge. Now, I think plenty of work to be done. And if I then take a final word towards the future, in December, next month, we will meet with 200 of the community members in the global WOPS community to talk about a lot of issues. Amongst them is sanitation. And I think it's not only the Kigali event in Rwanda, the IWA Congress, but it's also the African Water and Sanitation International Congress in Conakry that is upcoming next year, that will bring us hopefully more together to set the agenda towards 2030. And I think we all need to do that by networking together, by meeting and greeting each other physically, and continue on this webinar series with offline communities. Although it is a little bit of surrogate, I know, but we have to. And I think next year, and that's my final remark, next year there will be the World Water Forum in 2024, talking about sanitation and the way how to tackle the issues to bring sanitation forward and achieve that 80% coverage by 2030. I think we need to consolidate the information and the knowledge in your heads and in your minds and in your presentations to bring that on stage and to bring that on the table in Bali in May 2024. And also then we can have a cheers and say that we have a good plan. I think the stronghold of our community is that we are talking with practitioners who do not only talk and write, but know how to implement. Let's continue joining forces. And I think, well, it is a surrogate, I already told you, but if we can conclude now together by opening up our screen and then wave to each other, we at least have an idea that we have met each other a little bit more in person. I thank you all very much for joining. And please open up your screen and your video so that we can say goodbye to each other. And let's say till the next webinar, number 4 in this challenging series of 10. So I already start waving my hand, and I would like to you to do the same so that we have them all together in one big screen. I think there must be much more, I think. Can we handle that?
It will be coming on several screens. So
okay.
Our team will take pictures from first screen, second screen, third screen.
All right.
Asante sana. Thank you very much, everyone. That was a fantastic journey. Thank you, Chola. Thank you, everyone.
Thank you very much.
Good, good. Bye-bye. See you next time.
Bye, everyone.
Bye-bye.
Keep in touch. Bye-bye.
Bye.
Bye.
Thank you, Simon.
Well done, all of you.
Thankful. Bye.